Dr. Savitsky is a professor of emergency medicine and pediatric emergency medicine at the University of California, Los Angeles. As the founder and CEO of Sonosim, Dr. Savitsky is a pioneer in ultrasound education.
Great. Good morning, everyone. And Heidi, thanks for the introduction. Just really excited to be here with everybody at IMSH. And the topic here, we're going to break this morning's presentation down into several segments. And overall, what we want to deliver is the ability for people to really have a good appreciation in the simulation community of what it takes to successfully deliver ultrasound training using simulation in the era of COVID, and ideally, and hopefully sooner rather than later, in the time that follows. So first thing to talk about and to really look at is, what has resulted in the big insurgence and growth in point of care ultrasound. And there's a variety of reasons, ranging from ultrasound machines becoming smaller, more portable, easier to use, better quality images, which at the end of the day puts ultrasound technology in the hands of care providers. For years, ultrasound has been, for the most part, for decades in the hands of radiologists. And as the ultrasound machines have become more ubiquitous, care providers, whether you're emergency medicine, critical care, OBGYN, general surgery, pediatrics, MSK specialties, whatever the specialty in medicine, physician assistants, nursing students, medical students, everyone has their hands on ultrasound machines. And the power of ultrasound machines, probably one of the studies that really underscores this. This was a study that was done at this point over 10 years ago. And it looked at if you had a series of medical students and they were given about 18 hours of very focused training on how to look at the heart with a handheld ultrasound machine. And then they looked at how well could they predict valvular heart lesions as well as non-valvular heart lesions. And they compared them to seasoned cardiologists, so cardiologists that have been practicing their trade for over 10 years. And what this slide clearly illustrates, all of the columns in blue are the medical students' accuracy. The columns in black are the accuracy of seasoned cardiologists for detecting non-valvular heart lesions, cardiac lesions. And then the p-values are the small numbers. So you can see that, everything from LVE, which is left ventricular enlargement, to LVH, which is left ventricular hypertrophy, a bunch of different parameters. You can see that the medical students overall outscored the cardiologists, despite the cardiologists being practicing their trade for over 10 plus years. The medical students outscored them sometimes by as high as 20 to over 20% in terms of accuracy. And it's the slide on the left, it's the difference of being able to see tricuspid regurgitation and being able to quantify it versus having to listen through a stethoscope and attempting to infer and translate what those sounds are to pathological lesions. And for a variety of reasons, that is extremely challenging. And this really does underscore the power of point-of-care ultrasound. So, what's the role that ultrasound has played in the COVID era? And what other benefits does ultrasound provide? So one of the major things that ultrasound really facilitates. So I've been in the ER 3 out of the last 4 days. And when patients come in, many times they have undifferentiated complaints. And when they come in with undifferentiated complaints, helping sort through the differential diagnosis of shortness of breath or weakness or abdominal pain, or when there's a critically ill COVID patient that need to do a procedure. These 4 slides really illustrate, 4 different ways, general ways that ultrasound, point of care ultrasound, actually can really facilitate patient care. So when you have someone who comes in with dyspnea, your classic COVID patient, they're hypoxemic, but they're not air hungry. Many times you're trying to decide, is this a patient that gets monoclonal antibody and can be sent home, or do they need dexamethasone and be hospitalized? So you're looking at their oxygen saturations. You're trying to see very quickly and many times with limited resources what's going on in the patient's lungs. There are characteristic findings on lung ultrasound that are consistent with COVID infection, which you see in the upper left, where you get focal subpleural consolidations or B lines. Those findings are highly suggestive of COVID infection. And then depending on the distribution of those findings, you can infer the severity in concert with looking at the patient and the patient's pulse oximeter readings. Many times, COVID coronavirus can affect the heart. So you actually can get primary cardiac dysfunction where the ejection fraction diminishes. You can have myocarditis, myocardial infarctions, pericardial effusions. And looking at the heart is critically important, both for a primary cardiac event related to COVID, or many times the stress of the infection could cause a secondary cardiac event. And being able to look at that at the patient's bedside is critically important. And then you can have a variety of gastrointestinal symptoms with COVID. So looking for other conditions that could mimic a COVID presentation, screening for bowel obstructions and a variety of other maladies of the hepatobiliary system is incredibly valuable. And then these patients very often are critically ill. You can see how close the carotid artery in this slide is to the internal jugular vein. And when you're navigating and trying to put a catheter and a large dilator and a large needle and a guide wire into the internal jugular vein, you can see how critically important it is to be in the correct area and not accidentally puncture the carotid artery, as well as putting in peripheral IVs, which negate or preclude the need to really put in a central venous catheter. So these are just some quick examples of how point-of-care ultrasound helps in the era of COVID. And then once again, the rationale for what's driving point-of-care ultrasound to be adopted by so many people. And a key barrier to that adoption is the training and simulation technologies that are used to educate people on ultrasound. As this slide shows, ultrasound is unique in that it's only as useful as the user's ability to obtain an ultrasound image, interpret the ultrasound image, and then subsequently take the findings and apply them to medical care. And this is what huge benefit of ultrasound simulation is. So if ultrasound is so important and is being adopted so widely, why is it moving so slowly? And what's the role that ultrasound simulation and the simulation community can play in accelerating the adoption? So despite ultrasound being around for 50 plus years, it is still very, very slow to penetrate clinical medicine relative to its benefits. And the big challenge is the resources that are required to teach ultrasound and as well to assess how well people have learned ultrasound and assess their competency. So all of these elements we've kept in mind when we've developed the Sona Sim ultrasound training solution and a suite of products that support it. So if you think about the previous slide, all of the elements that we talk about, we've looked to either primarily develop or subsequently develop as part of our ecosystem. So we have 70 plus courses that cover a variety of different topics, and they're foundational courses that teach anatomy and physiology. There's our core clinical pathway that teaches pathologies and very relevant to people that are seeing patients as opposed to potentially students earlier, medical students, nursing students, PA students earlier in their educational cycle. There's advanced courses, which are great for fellows and people wanting in-depth training. And then we have our procedure modules, which teach how to do ultrasound guided procedures. So there's 70 plus courses, all cloud-based and supported with mobile applications. So really support remote learning and remote access to the courses independent of location. What you see on the screen is the Sonos Simulator. We'll do an in-depth review of what the Sonos Simulator provides, but in a nutshell, you can take a probe, plug it into a USB port, and have your own independent ultrasound training platform where you use real patient cases and you're able to scan through them. And once again, this provides pathology on demand. You could take 5 years of sitting in an emergency department or an ICU and imagine all the cases that you see, and you have them on your laptop on demand, and you can go through them in several weeks or several months, depending on the depth of training and knowledge you're looking to acquire. So a really, really powerful tool that lets you scan real patients on demand and not have to wait for. And then as a simulation center director, you need to manage your users, whether it's 1, 10, 20, 100, or even 1,000 users. You need the ability to facilitate making assignments, tracking how well users are doing, facilitating ultrasound educators across different specialties. And then most importantly, someone, including all the people that use the simulation center for ultrasound training, they need to be able to track how well people are achieving competency. And there's some really powerful tools that we'll present that allow ultrasound competency assessment and automated assessment using rule-based AI technologies that Sonos has developed. One of the other products that we have that we'll demonstrate is Sonos Live Scan with Case Builder. We'll do a remote simulation using Sona Sim Live Scan with Case Builder. And this is an incredibly powerful tool that allows us to use Sona Sim Live Scan tags. They can be put on people or mannequins, and you convert that person or mannequin into patients with a variety of different pathological conditions. You could make a bunch of different scenarios. This can be done remotely. And this, most importantly, is where the ultrasound simulation community can facilitate how do you test and assess how well people can take ultrasound findings, acquire an image, and then apply that towards medical decision making. And finally, ultrasound guided procedure training. You have a bunch of diagnostic ultrasound applications, and then you have therapeutic or image guided applications. And SonaSim has a variety of different procedures, everything from fundamentals of doing ultrasound guided procedures to how do you do peripheral IV access to central venous access, whether it's internal jugular, subclavian, femoral, and there are a variety of critical procedures such as pericardiocentesis, paracentesis, thoracentesis, as well as a variety of musculoskeletal injection and aspiration procedures of the major joints of the body. These are all done and taught in a cognitive training module format that we'll demonstrate shortly. So these are all the elements that are put together that are intended to overcome the previously mentioned barriers to ultrasound education training. Once again, this is a quick screenshot of a user being able to access the courses remotely through any internet-connected device. You have a mobile application, which is really important, that allows refresher training and can serve as a bedside reference tool for people. And then once again, all of these modules come with tests and test questions. So there's in-module questions that help reinforce learning after several concepts are presented. And then there's a mastery test at the end that a simulation center administrator or an ultrasound educator can access and see who's achieved competency based on the didactic knowledge presented and be able to track and provide feedback to users based on their didactic knowledge performance. Once again, this is the Sona Simulator and provides the real value of using the fanning, rocking, and tilting motions. You select the image windows. So you click on a particular image window, either on the body or on the Sona Simulator. The probe moves to that image window. And then once you're at that image window, the exact fanning, rocking, tilting maneuvers that you would do to acquire that image, you actually have to recreate with the Sona Sim probe, which has a built-in motion sensor. There's a virtual tutor that allows instant feedback in terms of image acquisition. There are findings videos narrated by ultrasound experts that provide feedback to the learner. And then most importantly, you can access a variety of different pathologies on demand 24/7. This screenshot shows the Sona Sim Performance Tracker. There's a variety of different applications and features within Performance Tracker. Beyond just assessing how well someone does on didactic knowledge, there's a variety of curriculum integration tools. You get feedback immediately on the images that you've saved, and you can provide, as an administrator, feedback to the learners. There are sample assignments that actually take someone through and ask them to apply the exact most important image acquisition tasks that are taught in each course. And as someone goes through the sample assignments, which there's one for each course, there's automated assessment powered by AI that will assess how well does someone acquire an image relative to the optimal view as established by subject matter experts. And that is done in an automated way and has huge benefits. And then ultrasound guided procedure training, once again, we use a cognitive task training approach to have someone learn the didactic knowledge required and then learn the procedural knowledge and execute the procedural steps to perform ultrasound guided procedures across a variety of different applications. All right, in closing, we're going to segue now and we're going to take about 5 minutes to discuss the Sona Simulator. All right, great. Good to be back with you guys. So I've got my Sona Sim probe in my hand. I'm in a remote setting hooked up to an internet connection using a PC. And what I'm going to demonstrate here is the Sona Simulator and a little bit of all of the features and the value. So here we've got a case list. You can see there's 101 modules to pick from. I am going to scroll through. First case I'll demonstrate is a renal case. I'll load case number 10. And here you get the case history. So I'm just going to take you through the workflow. So real patient, 30-year-old female with a history of kidney stones and allergies to NSAIDs, presents complaining of right flank pain, inability to void. We're asking the user to use sonography to acquire an image of the kidneys and the bladder and see if they see any pathology. So The movement I do with my hands is I fan through the kidney, the corresponding real ultrasound image appears. It looks like there's some high density calcification, maybe an intrarenal stone here. Here I see some anechoic areas within what should be hyperrenal sinus fat. And this looks like mild and moderate hypernephrosis. I can reposition a patient to a variety of different body positions based on my scanning preferences. Here, I'm going to leave her in an oblique position. And as I scan through, for learners, it's really important for them to have an appreciation as you fan an ultrasound transducer through the body, see how a variety of different image slices translate to an ultrasound image. We also have a tool that when it was relevant, patients underwent cross-sectional imaging. Here, the same patient underwent a CT scan. So the learner can understand how the probe and the transducer beam transects through the body, how it translates to an ultrasound image, and how that translates and correlates with a CT scan image of a kidney hypernephrosis with a spine with the liver and Morrison's pouch interposed between the two structures. So really valuable. As you're learning, you may not know, I'm going to put the probe in an unnatural position. I may not know how to get a long axis view of the kidney. And what Sona Sim provides is a probe guide. So this probe guide, if you align, it gives you a chime, gives you a green signal, and this tells you that you've gotten a long axis image that correlates with what our expert thought was the optimal image view. If you didn't know how to get a short axis image, you can put a short axis guide. And if you don't align correctly, I'm flipped 180 degrees, it doesn't tell me I'm in the correct position. But here, if I orient correctly, it tells me I've got the optimal short axis view as determined by expert. In addition to this, you're able to access our findings video. You're going to hear an expert narrate the findings as I scan through. Here, a pop-up window appears, and you're going to hear
a curved abdominal transducer to scan the right kidney of this 30-year-old female patient who presents with a history of multiple kidney stones and inability to void, cavity to NSAIDs, and right flank pain. We see the liver all around the right kidney, and right away we notice how prominent the collecting system looks. And this is more consistent with a mild to moderate hypernephrosis. So here you have the ability for an instructor to be with you 24/7, remotely or in person, that can actually help narrate what you're seeing. As a system administrator, you can put things in test mode, and when you put test mode, certain features like that findings video or the probe guide are inactivated, so the learner cannot use them. So this is if you were in a testing situation, you could deactivate those features. You have caliper functions that allow you to do a variety of caliper measurements. So if for whatever reason you wanted to do a diameter measurement, you can take the caliper, you can get a diameter of the kidney, you can freeze that image, you can save that image, you can annotate that image, and then you can review it subsequently later. You can change the gain function, increase gain, decrease gain, you can change the depth settings, you can flip the indicator based on your imaging convention. So a variety of tools and functionalities, including Doppler and different calipers that are relevant for the topic. You can move from image window to image window. So here I move into the bladder view, and I can scan through the bladder in a sagittal plane, in a transverse plane. Now I can select to move over and look at the anatomical left kidney. Here I fan through that. I can change my body position if I prefer, so I have a better understanding of exactly kind of how the probe is positioned and see if there's any pathology, and there is none there. One other thing that I wanted to highlight really quickly is the cognitive task training modules for ultrasound related procedures. This is critically important. And once again, we have a variety of different procedures that we can teach. Here, we're actually going to be teaching how to perform internal jugular vein cannulation. So I'll load a case, 42-year-old male requiring a central line. Please use ultrasound to perform the procedure. So here I'm doing my survey scan where I'm scanning through the anatomical right neck. I see two structures. I can use my Doppler and see that this is phasic flow. This is pulsatile flow. So this is more consistent with venous flow versus arterial flow. I can use my compression button down here, and I can see that the vein collapses completely as opposed to the artery, which does not. So this is my target. I'm going to move into procedure scan mode, and I'm going to select advanced user. I can change body positions. I can have the expert findings video narrate the anatomy if I need. But my first step is I'm going to align my target structure, which is the vein. And I'm going to put the vein right down the middle of the screen. So vein is here. Next, I'm going to click the needle.
I'm going to position the needle right in the middle of my probe. I'm going to put it adjacent to my probe. And now I'm going to change my entry angle. You can see here, right over here over the left lower bar, it will tell you the angle. I'm going to drop to about 45 degrees. And I'm going to attempt to use out of plane needle guidance to guide and walk the needle into the internal jugular vein. So here I'm going to fan towards the vein. I'm going to start to advance the needle, and I'm going to look to see if I can identify the needle tip. And I see the needle tip right there, right on my needle screen. I'm going to fan the probe away till it disappears. Now I'm going to advance the needle. I'm going to fan my probe away till it disappears. I'm going to advance my needle. I'm going to fan my probe away till it disappears, the needle tip. I'm going to advance my needle. Now I know I'm in the vessel, and I've quote unquote walked the needle in using out of plane guidance. Because of the artery being posterior, I'm going to rotate into in-plane guidance at this point. This is a critical step. I see a lot of learners, novice ultrasound users, they're much more comfortable with out-of-plane guidance, but they do not have the dexterity, the hand-eye visuomotor skills, the psychomotor skills required to go into in-plane guidance, which is critical to making sure you do procedures safely. Here, I can guide the needle tip in using in-plane guidance. I'm going to purposefully go through the back wall here of the vessel. I'm going to go through the back wall, and I'm going to get near the artery. And then I'm going to back the needle out. So I'm going to pull the needle back, get back in the vessel. And here is where we have our automated assessment with AI. It's tracked everything that I'm doing. It's going to tell me you've cannulated the internal jugular vein. However, earlier, you traversed the border of the internal jugular vein. So it's caught that I did the procedure incorrectly, and I can try again. This entire process was done without an instructor looking over your shoulder, without needing to actually stick the needle into a patient. So incredibly valuable. And once again, we have a variety of different procedures that we can apply this to, and a variety of different learning opportunities. So you can learn how to do a pericardiocentesis, where you can literally use the same technology. Here in a parasternal view, I can see what looks like a very moderate to large pericardial effusion. I can view it through a variety of different views. Here I look at it through an apical four chamber. Here I look at it from a subcostal perspective to confirm that indeed it is a large pericardial effusion. And then here I can actually attempt to do a pericardiocentesis using the same techniques with the probe, with the needle, or I can choose to try to do it from an alternative approach using a phased array transducer. So a variety of different procedures using cognitive task training modules to really make sure people have the didactic knowledge, procedural knowledge, and most importantly, know the physical steps that need to go through to be able to successfully perform a procedure. This can be done remotely, and when they come into a simulation center in live instruction, they can try to do these on physical mannequins with needles, but they've got the advantage of acquiring the knowledge and the procedural skills and the cognitive steps to be successful. And most importantly, they can practice on real patients, real patient pathology, and really learn ultrasound anatomy and be able to apply that towards performing the procedure. And then come in when they learn on synthetic 3D printed molds, they can further refine their expertise before actually practicing on a patient or performing the procedure on a patient. Appreciate everybody's time and attention.
All right, everyone. Thank you so much for your patience during the beginning part of that presentation. We might not have too much time. For the interest of time, we'll try to get to a couple questions from the group. But like I said, you're more than welcome to send us a message at info@sonosim.com, and we will absolutely provide a complimentary trial of the Sonosim courses and the mobile app. So with that, I'm going to go ahead and open up for a couple questions. Olivia, do we have a couple more minutes?
Yep, you have a couple more minutes. You should be good.
Okay, fantastic. Well, the first question comes from Lori, and she asks, can students share probes but have their own didactic, or must you purchase a probe for each student? And I'll pass that question off to Dr. Savitsky.
Yeah, happy to answer that. Yeah, there's a variety. Your local Sonos Sim territory manager can go through it, but there's a variety of different forms that learners could access the Sonos Sim offerings, and whether it's a one learner, one probe, which in many ways is the most effective way of learning, but obviously depending on the depth of the curriculum, that may or may not be an optimal choice. Or there's the ability of having a workstation or series of workstations and simulation centers, and having people have remote access to the courses, and then can use the workstation for any hands-on instruction. So there's a variety of different flexible options that we've been able to develop in response to simulation center based and remote based learner needs. So a lot of flexibility there.
Okay, great. Juan Carlos Alonso also asked, could you please talk a little bit more about the training with Sonos Sim remotely? What stuff students need to have at home?
Sure. Yeah. So depending on the product and the application, for Sona Sim Live Scan with Case Builder, which can be used remotely, there it's just basically an internet connection, and then the instructor remotely creates the case and invites the students and the learners to interpret images and apply them towards medical decision making. For all other ultrasound Sona Sim applications, everything is, as long as you have an internet connection, PC, and a USB plug-in, you have a remote workstation that would mirror what you would have in a simulation center, and provides you a lot of flexibility for both remote and live instruction, whether it's simulation center based or remote based. And the simulation center serves as the hub, and really helps administrators address their learner needs and assess performance and competency.
Okay, great. I think Kathleen looks like she made a comment there that your program liked the performance metrics. So thank you for that, Kathleen. And Brenda did ask about specific costs, particularly with dealing with a large number of students, 50 or more. We do have a lot of flexible pricing options. We'd be more than happy to share those with you. If you'd like to send us a message at info@sonosim.com, and we'd be more than happy to break down those specific costs for you. All right, any other questions? Oh, I see one last question from Dwayne Patterson. Can vital signs be adjusted and have the images reflect the change?
Yeah, that is a wonderful question, and that will be rolled out as of July of 2021. So it'll be a late Q2, early Q3 offering, where we, within Case Builder, when you do modify heart rate as well as respiratory rate, it changes virtually, and it also changes within the ultrasound image. So that's a very dynamic, very a helpful feature, as the earlier presenter presented, when you're creating dynamic scenarios. So that will be integrated and will be available as of late Q2, early Q3 of 2021.
Okay, wonderful. Now, just to respect our time, I'm going to go ahead and pass the ball back to Olivia for our next presenter. But we will be available. The Sonos team will be available to answer your chat questions throughout the other sessions. And of course, you're more than welcome to send us an email over at info@sonosim. Thank you so much for your time.